Good evening, everyone. Thank you for joining us tonight. We're thrilled to be on to share just two amazing testimonials with two precious ladies that I'm just excited to share. And Dr. Stacy, how have you been doing today?
I have been doing amazing. It's been a wonderful day.
Very good. Stacy's over in Texas and I'm in South Carolina. So we had a hot day here today. Let's see, everybody looks like they're joining in. Still so many people are coming in.
Yes, David could go ahead and read the whatever. Yes, thank you.
Yes. That thing.
No problem. All LifeWave products are not intended to cure, treat, diagnose, or prevent any diseases. If you're pregnant, nursing, have medical conditions, or on medications, please consult with your physician first. Our patching podcast is to educational purposes only. And now back to our beautiful host. Thank you.
Thank you. Okay, April, let's get started. We're so excited.
Thank you so much. And we have our first guest tonight is the beautiful Dr. Cashell Southwick. She is 44 years young, and she's a doctor of pharmacy, a functional health practitioner, and consultant. And she was previously an infectious disease clinical pharmacist and a disease state manager. In addition to her doctorate, she studied biology and chemistry. She's an amazing mom of three cool kids, 17, 15, and 12. And she is so lucky to be married to her high school sweetheart. So, Cashell, thank you for joining us tonight. And we're just excited for you to share your wonderful testimony you were sharing with me, with your daughter, and all yourself, all the things you've learned about LifeWave. So just tell us your journey and who introduced you to these patches, and how things have been over for the past few months for you, since this has been such a life-changing thing for your family as well.
Yeah, it was a complete happy accident. Really, my good friend called to check on my daughter. My daughter had she was 11 last September, had a traumatic brain injury that resulted in a brain hemorrhage, and she was discharged from the hospital, and we were very blessed. It could have been a lot worse. And she went through hyperbaric oxygen. We did rehab, we did acupuncture. I've always been somewhat of a researchaholic. And so when traditional medicine kind of left us hanging, there wasn't a whole lot of things that they had to offer her. We kind of went out of the box, and she went back to school about part-time right before Christmas break and kind of did all the holiday parties, and then went back full-time in January. And her academics were struggling. And about that time, my husband and I said, oh my gosh, we have to do something else. And Dina called and said, hey, I've had just this miraculous response with my daughter, and she has a special needs daughter. And she said, if they can heal my daughter's brain, I think you should try them for your daughter's brain. And the researchaholic in me, started researching them. And that's probably my biggest regret, is I spent probably about 6 weeks digging into all of the clinical trials and reading the studies and listening to testimonial calls just like this one. And finally at the, probably midpoint, my husband and I decided that it was something we had to at least give a try. So I had texted Dina, and I said, I think I asked her, I said, well, how much is this anyway? And she kind of said, well, let's talk. And I thought, oh boy, that's never a good sign. And was anticipating that it being a lot more expensive than what it was. And so when she told me the price, I thought, oh shoot, if you would have told me that, I would have just jumped on board probably a month before. I probably would have at least read some of the clinical trials. But anyway, I thought before I experiment on my 11-year-old, I would put him on myself. So I have scoliosis in my back. And so I have struggled with some low back pain. I'm not a medicine taker, despite being a pharmacist. I don't like to take any kind of medication. I feel like my job is always to tell people all the side effects and the reasons why maybe they should be careful. And so I tend not to take a lot of medication. And so I was sitting at my desk doing my chart reviews and whatnot from home, and having to sit with a TENS machine on because my back hurt so bad. And I wasn't getting relief from a chiropractor anymore. And, the funny thing is Dina asked if I needed anything. And I said, oh no, I'm perfect. Actually, I don't have any problems. I don't have anything. And she's like, okay. And so I tried them for the first week, the X39 and the Aeon, and I put them on my low back. So the X39 on my spine and the Aeon kind of on my right loin, and kind of right where you put your hand on your hip. And about the third day of wearing the patches, I had just a dramatic improvement in my level of pain. I just thought, am I feeling something? Like, am I losing my mind, or am I actually feeling something working in these patches? And by the end of the first week, I couldn't find a sore spot. I was kind of putting them right on the point of pain, and I really couldn't find a sore spot. And so at the end of the week, I kind of thought, well, maybe I'm going to stay on these too. So I did, and I started Elena on them. And so it was kind of an accident that I started the patches, because I had no intention of spending $100 a month on myself. And so pretty much that's how I got started in them. And Dina told me a little bit about the business aspect of it. And I said, oh no, that is not for me. I will not be doing the business part of it. I have no desire to do that. And she said, well, you just wait. When you get your miracle, you won't be able to help yourself, and you'll have to share your story. And so here I am. I just started my basically 5th month of the patches, and I don't think I'll be going without them anytime soon. I've experimented on myself a little bit, and I can skip a day or two, even once in a while, 3 or 4. But boy, by that 5th day, I am reminded how bad I used to feel. So I don't like to skip days. I don't like to be inconsistent. It's one of the things I counsel people on is, hey, be consistent. Make sure that you're wearing them every single day as you're supposed to. Don't skip. You're not going to get the same results if you're not consistent. But some of my background is I live here in Arizona, and as a transplant Arizona person, I came from Michigan. I got valley fever really bad. I was one of the lucky or unlucky 1% that get a nodule. And so I had a valley fever nodule burst in my right lower lobe. And I ended up with a pretty decent size 1 centimeter calcification. My original nodule was 4.2 centimeters. So the nodule stays, it's kind of like a scar, or on an x-ray, it looks like a tumor in your lung. And that left me with some shortness of breath, difficulty, like sometimes with exercise-induced type asthma, very reactive lungs. So if I walk through cigarette smoke or even trick-or-treating and everybody with their fire pits out here in Arizona, I would cough and hack and wheeze for weeks after any kind of exposure to that. So, and with valley fever, you can't take any steroids. So it's kind of just left with scarred lungs, I guess. I also had low thyroid. So I took thyroid medicine, being in my 40s, every year it seemed like the scale and I kind of had a more weighty relationship. Not that I've ever been a super heavy person, but just, the scale kind of creeped up there. I've always been active and exercise, but I just really just couldn't ever lose any weight. So I started patching, and I started with X39 and the Aeon on my back. And then we had that awesome kind of summer special where you got an SP6 for free. So I thought, well, I'm going to try it. And I started wearing the SP6, and probably about between a week and 10 days in, I kind of accidentally forgot my thyroid medicine. And I kind of about a week after forgetting it for a week, I just decided, well, I haven't noticed that I wasn't taking it. So I stopped taking it. And I'm a numbers person. I'm very lab value oriented. And I went and got my blood work done about 8 weeks after being off the thyroid medicine. and my blood work was all better than it had been last summer. So that was a happy accident with the patches. And of course, my low back is feeling much better. I mean, I pretty much don't have any back pain unless I do something to deserve it. Other than that, I have no back pain. The other kind of cool thing is we were sitting around the campfire up north at our cabin, and my husband looked over at me and he goes, "You haven't been wheezing lately." And I was like, "Oh, actually, you're right. I haven't even been carrying my rescue inhaler. I don't wheeze anymore. I don't get short of breath. I exercise without any difficulty." And so that also has been kind of a happy accident. My daughter, the most amazing part, and probably the most, part that I'm the most thankful for, is that she wore the patches for about 2 months, so April and May, and we had gotten her state testing. Our school district does it, I think it's like the end of February, first part of March, right before spring break. And she was around 60%. She was struggling about 60% in all of her core subjects. And that's unusual. She was kind of an all A student prior to her accident. And so we started patching her. She was using very consistently the Aeon and the X39, and then more or less consistently the Elevata, probably not 7 days a week, but maybe 4 days a week, mostly the 4 days that I would remember, to do it at night. And she was struggling in school. She, like I said, about 60%, and she was struggling to sleep. She, in 2 months, well,
okay,
really
the same thing.
Yeah, really about her first night on the patches, she slept through the night, which was a nice gift to me, because then she slept through the night, I got to sleep through the night. In 2 months, she went from, like I said, barely getting 60% to she ended up getting 95% or better on all 4 of her core subjects for her final grades. So we had a dramatic improvement. She was more noise tolerant. She had less headaches. We still have a little bit of struggles with headaches and not really noise sensitivity so much, but maybe just the feeling of being a little overwhelmed. And again, I'm going to say it's a lesson that I learned the hard way, is in being consistent, is because I let her kind of take the summer off. She was doing so well. And so I didn't patch over the summer, and we just went back to school, and I was like, we need to start the patches again. So we just started the patches again when she went back to school here about 3 weeks ago, and I can already tell a difference. So it's been a bit of a miracle for our family. And just like Dina said, when you get your miracle, you won't be able to help yourself from sharing with others. And 1, that's why I'm here today. And 2, it has just transformed my life. I've always been a patient advocate and been very, I take very personally the care of my friends and my family and my patients. And this product has just been a blessing to everyone I know. I've had just the most amazing results with my friends and my family. It's just been wonderful. So I'm so thankful that we have these patches, and I really believe that this is the future of medicine. I think that we are kind of at the cusp of something magical here. I think it's wonderful. So do you have any any other questions?
That was just so wonderful. I mean, all the different things it's done for your daughter, for you, and just let's say 5 months you've been using the patches, and then you were noticing massive pain relief in 3 days.
Yeah.
And then your daughter, like the academic, the difference you can tell that is working and making a difference in her brain. That's so huge that you can see it on her grades. You see the difference, and she probably knows the difference also.
Oh, even we went back to school about 3 weeks ago, and she was struggling even in the second or third day of math class, and she was already overwhelmed and frustrated. And she's like, Mom, I can't do this. I can't do this math class. And she is, I mean, she's in an honors class, because we push our kids. So she's in an honors class math, and she's like, I don't think I can do this. I don't remember these things. And really, right, the back to teacher, back to school, meet the teacher night, she was just overwhelmed by, the number of kids in the school. And she switched from, K through 6 to 7 through 12. And so she was overwhelmed and kind of intimidated. And so I said, I think we need to go back on the patches. And then, kind of being a irresponsible mom. I didn't go home and slap one on her. I kind of thought, okay, I'm going to start doing that. And then, next thing I know, we're 4 or 5 days into school, and she's been struggling with her math, and literally putting the patch on a couple of days later, all of a sudden I said, where's your math homework? I did it in school. And so I pull up her grades, and sure enough, she's done all of her homework, and she's gotten 100% on her math assignments, and she's doing it all in school.
Which patches were you using for her exactly, for your daughter? Which patches?
Yeah. So she consistently is wearing X39 and Aeon. Those are my two favorite. Yeah. And then occasionally we'll do an Elevata.
Wonderful. And for you, someone was asking, where did you place for your scoliosis, for your back pain? Where did you say you placed the patches? Someone said, where on your body were you using the patches?
Yeah. So for myself, I recommend X39 on the spine. So, typically it can go on the back of the neck. I put it on the base, down where my pain is, my low spine. And then I put the Aeon, kind of where your thumb goes when you put your hand on your hip. So in the loin, in that tender, that tight muscle there in your back, that's where I wear the
Aeon. You're putting it just right there on the point of pain.
Point of pain. Yeah, you can't go wrong with that. Yeah.
Well, that was so much. And Cashell, we cannot wait to have you come back.
Yes.
Dr. Stacy, did you have any questions for her? Because she went through everything so wonderfully. Everything just explained everything just great. So I can't wait to have you back and to see you 5 months in, and you already have just miracles happening in your family as well. So Dr. Stacy, you're muted. Stacy, you're muted.
I'm muted. Yes, I have to remember. Thank you so much. It was wonderful. It was a lot of great details, and I know it's going to help a lot of people. And so thank you. I'm excited because our next guest is Victoria Thibault, and I've known Victoria for about a year. She's 67, which when she told me, I said, I thought you were at least 54 or younger. So I'm just what? And so I'm excited to hear from her and I'm just going to let her tell what she had going on. And Victoria, you just give us all the good details and stuff like this. What did you have going on before the patches?
Hey, Stacy, I will tell you, I had a lot going on right before COVID hit. I was diagnosed with macular degeneration. I didn't really understand what was going on with my eyes, but I noticed my eyesight was getting worse and worse, and I kept thinking it was allergies. So I was taking allergy medicine and, just kept pushing through. And when I was diagnosed, they couldn't believe that I was even still driving. And I was diagnosed as legally blind. And so they started doing the retinologist. I started seeing a retinologist, and I started getting shots in both of my eyes. And about every 6 weeks, once a month. I think I started out with like once a month. That's how bad it was. And the closer they put the shots together is the worse your eyes are. And I didn't know anything about macular degeneration. I didn't know anything about, eye issues or anything like that. And I started taking let me see, when had that happen? That was 4 years ago. And right after COVID hit and they shut down the state, I couldn't get any shots, and I had a massive hemorrhage in my left eye. And my doctor told me I needed to pray. That's how bad it was. And I really couldn't see anything. I could make out, getting around and everything, but I couldn't see to live and enjoy life. And I'm a gardener, and a photographer. So it was very detrimental for me, and it just very depressing. And sometimes I would sit there and go, oh God, I need an answer. And a friend of mine introduced me to the patches. She kept telling me about them. So I highly recommend anybody, if somebody's ignoring you, just stay consistent and persistent in sharing the good news of these patches. And so I decided I'm going to try anything, because I had tried different nutrition. I had tried different stem cell drops, supplements. I'm very into health and nutrition, and I'd always, tried to eat healthy and exercise and take care of myself. But nothing was changing anything. So when I decided to try the patches, which was a year ago, within a month, I started noticing that I think there's something to this. So I decided I was gonna give it a go. And I did the X39 and the Eon for a couple of months. And as I watched the patching podcast, I started learning more about the different patches and what they did. And I decided I needed the carnosine and the glutathione as well. And so I added those two to my regime, and I have noticed a huge difference. Within, I would say 6 months or so, I could start seeing the horizon, whereas before I couldn't even hardly see the beach, driving down the beach, and I could see the horizon. And then a couple of months later, I could see the ships on the horizon. I mean, I would be so excited. We take our eyesight so for granted, and we just don't realize how valuable of a gift it is. And I'm still in my recovery of the macular, but I can see your face with my glasses. I decided I would try my glasses, because normally I used this magnifying glass, which was a huge, everybody knows me for my magnifying glass, but I can see to push the little button for the microphone, which is huge. I haven't been able to wear reading glasses in at least 4 years. So I'm very excited about the patches. I would highly recommend anybody that's got any kind of eye issues, definitely.
Yes. And now I know a lot of people are going to have a question, and I don't know enough about macular degeneration but I know that some people say there's dry eye, there's wet. Which type do you have, just so it can be clear for people that might be asking this question?
Sure. It's wet. And from what I understand, that's the worst. I have friends that have dry, and they're still driving, they're still managing, to live fine with their life. With the wet, and I don't understand the difference between the two or anything. I haven't really delved into doing any research on any of that. Looking at the computer and things, I with my eyes, I can't really do that. But I listen to a lot of stuff like the podcasts and things like that. But yeah.
Now, and I remember a few weeks ago or so that you were cooking, and you had said that the spice jar, you were able to read the back of the spice jar, and that was huge.
That was huge. Yeah.
Yeah. And it's not that you haven't been health and wellness, because you've been a health and nutrition ministry for over 30 years. So you already were in the process of good health and nutrition.
Yes. Yeah. Yes.
Yeah. Well, very good. I know I will just share, when I first met Victoria, I actually came down with her person that sponsored her, and Victoria would look, and her eyes would be not on you. It would be looking in a different direction, and she'd be looking up, talking to you. And I knew she couldn't even see me. And then, like she said, within about 6 months, I had seen her again. It was 6 months later. And when I came up the steps, she was looking straight at each person as they came in. And I knew at that point that her vision had changed, and she was able to see me. And I was like, I had to tell her, because I don't know if she realized that. And so that was very exciting. And so it's been wonderful to celebrate your journey. And just to reiterate, you were using X39 and Eon to start with, and a few months later, you added in glutathione and carnosine. Is that correct?
Yes. Yes.
Very good. Anything else you want to share? I know you said you also had improvements with sleep and energy?
I have it. I was struggling with sleep because of some other things that were going on, but my sleep has totally improved. My energy level, I'd always been, high energy. And, I think with the situation with the eye, because of the strain on the eyes and just the stress from, straining to see was making me more tired. And with using these patches, it has given me a lot more energy. I will say, Stacy, I wear my patches by my eyes. Sometimes if I'm just home by myself, I'll wear them across my forehead.
Mm-hmm.
I do wear them up around. I was wearing it on the back of my neck, the regular places. And I just felt like I needed to move them. And I feel like I've gotten better improvement by moving the carnosine and the glutathione up around my eyes. Now I wear my Eon at night.
Mm-hmm.
And I did add the Alavita. I do like the Alavita, but I wasn't adding that for that. I was adding it for my brain and my skin, but yeah.
And the X39, where do you wear the X39?
I actually wear it. I've got an X39 and X49 over here today.
Ah, very good. Okay.
Yeah.
Wonderful. Very good. Well, thank you, Victoria, for sharing this. And this is so exciting. And April, did you have any questions for Victoria?
I was gonna ask some of those you just asked about where did she wear them, and you had covered them all, because I was seeing in the chat people were wondering, Victoria, they're so concerned because so many people have eye issues. A lot of people have the same condition that you were having, as some of the questions were coming in also for Cashell. So y'all both covered everything just perfectly.
Oh,
yes, very good. Well, and so many people are probably thinking, okay, what is this we're talking about? And so we talked about a few other patches, but our main patch that we focus on is X39, and it's about this size as Victoria showed you right there. And you wear it 12 hours on, 12 hours off, and you just peel it off, you slap it on. The book will show you under the belly button or about the back of the neck. But like Victoria said, she does like to wear it there. Them are the recommended clinical studies they did, is the back of the neck on C7 and under the belly button. So, and then also, April, you're going to give us a little bit of information. And I know we kind of ran long, but we had some fabulous testimonies. Thank you, ladies. Go ahead, April.
We sure did. Well, Victoria and Dr. Cashell, thank you so much for sharing. Those were two wonderful testimonials, and I know many people will be helped from the recording. Thank you so much. And like Stacey was saying, David Smith, he's the man behind this wearable light technology. He's our inventor. He's our owner. He's our brilliant scientist that just lives in Orlando, Florida. And I love that. He's just a man with a huge heart that's been working, and we're about to celebrate 20 years with LifeWave. In November will be our 20th year. Even after 20 years, we have zero competition. No one else has this technology. LifeWave is a 19-year-old company. We're in 81 countries. We're a biotech company with over 94 patents, and 70 of those are in regenerative science. And what happened 3 years ago was the X39 came out. And that one took our company by storm. At the time, LifeWave was doing around 30 million a year. But last year we finished out at over 300 million. And this we're on track. We're blowing every month. We're just going by. We're blowing every record there's ever been set for LifeWave. So I know the corporate team just can't even believe it. So I guess the question mostly I think to myself is, and maybe y'all will too, is every day, who do you know that needs this? Who do you know that's in pain? They're suffering, they're stressed. They have low energy, they have, back pain, they have eye issues like our two ladies tonight were suffering with. I know for one that I'm so thankful that I found out about this wearable wellness myself a little over 2 years ago, 26 months now since I've learned about it. And it helped my joint pain more than anything has ever touched. I too, pain relief in just a couple of days. It was absolutely amazing. So how can you get your hands on these? That's the other question. How can you get your hands on these is what I was wanting to know too. And so a lovely lady called me right when I learned about them. She called me back and she said, April, you can pick retail. You can pay full price for these patches, or you can become a preferred customer, or you can get the same price I get and you can pick one of 5 different wholesale packages. And that's what I did. I needed them at the time for myself and my son. So I picked what they call a gold pack. And that gave myself and my son about 10, 11 different sleeves that we could pick from because I had severe joint pain and lots of other issues going on. So they've truly changed my life. So get back with whoever invited you here tonight, and they can, just hook you up with the best price, whatever suits you, that'll fit your health concerns, put together what'll be good for you. And if you'd like to learn more, here's some more testimonies, hear all our science, our clinical studies, the patents, go through all the research yourself. Please visit startx39now.com. And I know David's put that in the chat for us, but please visit that site where you can learn so much from there. If you'd like to share your testimony, get back with one of us too, because we do this Monday night through Thursday night. And also on Friday, we'll be back during the day. We always do a 4:00 Eastern and a 1:00 Pacific patching podcast as well then. So we would love to have you join us for those and invite your friends so they can learn more about this wonderful technology. Stacy, do you have anything else we could share tonight?
No, thank you for coming this evening. We loved it. And thank you, ladies, for the testimony. And thank you for joining us this Thursday. And me and April will be back on Monday on our normal night and have 2 more wonderful testimonies. And we believe tomorrow will be the podcast. And but just pay attention to the chats to see if it's canceled or not, because we think it's going on tomorrow. And just to let you know, because we are doing some traveling. If you're in the California area, if you go on startx39now.com, you can see the location in California where they're having a special meeting this weekend. And thank you for your time this evening, and have a wonderful weekend.
Thank you, guys.